Welcome to JIVINITI, connecting the dots on UnChained TV for everything from plant-based eats, animal rights, food justice, and environmentalism news. I'm Nivi Jaswal, your host and the founder of JIVINITI and the VIRSA Foundation, where we focus on matters of public health, planetary health, and intersectional veganism. Today's discussion is all about nutrition science and veganism, so please stick around if you're trying to eat healthy and don't know where to start, because Dr. Shireen Kassam and Dr. Zahra Kassam, they have all the answers for you. They're my fabulous panelists today. Shireen and Zahra, welcome to the show.
Thank you.
Thank you so much for having us.
You're most welcome, and thank you. Shireen, my first question is for you, so let's jump right in. You're a consultant hematologist at King's College Hospital in London. And my question to you is, tell us about your work and practice in the UK before we deep dive into the fabulous book you guys have written together.
Great, thank you for asking, Nivi. Yeah, so I do quite a few things here in the UK. So I guess my conventional everyday job is working at King's College Hospital as a haematologist. So working with patients and blood disorders, looking down the microscope and also treating patients with a type of cancer called lymphoma. So I bridge the gap between sort of clinical and laboratory practice. But as you well know, I also have another life of promoting and educating people on healthy plant-based diets. I do that at Winchester University, where I teach the UK's only course on plant-based nutrition aimed at health professionals and CPD accredited by the Lifestyle Medicine Societies in the UK and the US. And then I also am founder of Plant-Based Health Professionals UK, which is a community interest company and a membership organisation of healthcare professionals and the general public, providing evidence-based education and advocacy on healthy plant-based diets as a means of preventing and treating chronic disease. And that's then led on to launching an actual lifestyle medicine service here in the UK with my friend, colleague and co-founder, Dr. Laura Freeman, and that's called Plant-Based Health Online. So people can access a plant-based health professional to improve their health, prevent chronic disease, and basically thrive on plant-based nutrition and healthy lifestyle habits.
Yeah, wow, this is just awesome. And I do know about plant-based health care online that you mentioned you started with Dr. Freeman. How's that taken off in the UK? And is it possible for people outside of the UK to also participate and get your consultation?
Yes, for sure. So slow and steady, like with any new venture, but has had a really good response, and we've supported a lot of people one-to-one and also in group consultations to improve their health and well-being, and we've had some great feedback. So yes, it's available UK-wide because it's an online platform, and then our nutritionists and dietitians can see people outside of the UK as well, although we're not currently covering US and Canada because you have an amazing organization called Plant-Based Telehealth, and there's no reason to compete. There's the rest of the world to mop up in the meantime.
All right, that sounds great. All right, Zahra, my next question is for you. Tell us about your work and practice in Canada.
So I trained in the UK, but came over to Canada for a fellowship in 2004 for 1 year, but it's now 2021, so it morphed into more than that. I did my fellowship at Princess Margaret Hospital, and then my husband and I decided to stay. I'm a radiation oncologist. I specialize in radiation treatment for patients who have breast cancer and gastrointestinal cancers. And I practice in a regional cancer center in Ontario. So that's my conventional life. And then inspired by Shireen, I co-founded Plant-Based Canada with my very good friend and colleague, Michelle Fideli, who is a plant-based dietitian at the cancer center that I work. And Shireen had put on her first conference in the UK on plant-based nutrition for health, and I had come over to visit, to support her and to be at the conference, and I was just blown away. So I asked Shireen if she would help me put on a similar conference in Canada, because just like in the UK at that time, in Canada, there seemed to be a gap here in Canada on knowledge of plant-based nutrition and how it really is very health promoting, the healthiest diet you could be on and the healthiest diet for the planet. And although in Canada we're so close to the US, there are a number of wonderful plant-based nutrition conferences in the US. You do actually have to go to the US to access them. Some of them are not available to the public, and they're pricey. So we wanted to have that piece in Canada. We wanted to provide educational activities that were accessible to the public and to health professionals. And so that's how Plant-Based Canada came about.
Right. And are you open to the public? Anyone can attend? It doesn't have to be only healthcare professionals in Canada?
Absolutely. Just like Shireen's conferences in the UK, it's for everybody, and we don't dumb it down. We provide very evidence-based education. We have our yearly conference, we have our Plant-Based Canada podcast, and we say yes to anybody who invites us to speak about our favorite topic.
Absolutely. On UnChained TV, our favorite topic is really talking about plant-based nutrition and how it can, have an awesome impact on our health and on the planet, and obviously on all the sentient beings on the planet. There are just so many reasons to choose plant-based at this point in time, and especially in the aftermath of COP26, right? Which has been less than encouraging, in terms of whatever's transpired. But I know that with, amazing efforts on the part of plant-based professionals and lifestyle medicine professionals such as yourselves, where transformation of the world is probably closer, than we think. I just try to be optimistic. But let me ask you, there's always, a point in time, and people never tire of telling that story about, and then the pin dropped for me, and I know I had to go plant-based because this was the right thing for me to do. So Shireen, what sparked your interest in plant-based?
Yeah, thank you for asking. It's always interesting to look back, isn't it? I'd been vegetarian since 2001. I decided I didn't want to eat animals any longer. I never really liked the taste, so it wasn't a big deal, but I carried on in a rather unconscious way consuming eggs and dairy. And it took rather a long time till 2013, when myself, my sister Layla, and of course Zahra were having these sort of recurrent conversations about the egg and dairy industry. And the more we learned, the less we liked what we learned. And it no longer sat comfortably with our ethical and moral standpoint. So I became vegan for the ethical reasons, August 2013. You don't really forget when it happened. And that led to further discovery of how to eat well, because I hadn't really, you don't have to think so much when you're vegetarian about how to live well, eat well in a nutritious way. And, even sort of 8-9 years ago, the vegan food landscape was slightly different from now, and it wasn't so easily accessible. So it was that discovery from my own personal health and knowledge that led to this kind of, wealth of information that was out there just ready to be, absorbed. And I was getting most of my education out of the US at the time. We all know the great pioneers like Neil Barnard and Dean Ornish and so forth, and of course Brenda Davis in Canada. Took up all those books and original papers, the documentaries, and then the rest is history, as it were. I thought, well, I can't keep quiet about this any longer. The UK needs to hear it too.
Absolutely. And it's one of those things, you see it, you can't unsee it. And Zahra, so how was the journey for you? When was it? And was it also August of, when Shireen changed her dietary habits? How did this thinking within the family impact you?
Yeah, absolutely. My story really mirrors Shireen's. I'd been vegetarian for many years, and then it was that year, 2013, that, we're an incredibly close family. We speak regularly. We know what each other is doing. And so Shireen, Layla, and I had been talking about this and gradually evolving in our thinking. And then absolutely, it was the same time, 2013, that we all became vegan together. And it's so wonderful to have that support. Many people don't have that support and are doing it alone, which is not so nice. So that that piece was there. And as Shireen said, that blew open this whole world of plant-based nutrition for health. And given our professions, that we really felt that was somewhere we could contribute.
Right. So, and given that, even though you're in the same family, obviously, but you're in two different continents, and the consciousness around veganism is very different. Like the UK is ways ahead, light years ahead of the US at this point. Like, I'm really curious to know when you decided, what were the initial challenges that each of you faced, in order to start eating this way? And in your respective countries. Shireen.
I guess on a personal level and sort of eating at home and what have you wasn't that big a deal because, our traditional South Asian diets are so easily adaptable. My husband loves curries too, despite being, British from Kent. And so, that sort of adaptation at home really wasn't a big deal. And, we're so fortunate that our parents support all our decision making without question. And so, even family meals were straightforward. So I guess at the time it was a bit more difficult when eating out or, being on the run and not having something with you for snacks. And then talking amongst my colleagues and health professionals at work and explaining my choices and why it is, the best approach for human and planetary health and of course the animals. So it was more those sort of conversations with others that were the more challenging, and then being out and about vegan, because, the motto of every vegan is always be prepared, but you have to learn that for yourself, right?
Yes, absolutely. Zahra, what about you? In Canada, where you live, how did you navigate the culinary environment?
Yeah, I mean, individually, as Shireen said, it was easy. You made the decision, it's done. Yeah. That's the way you're going. My husband was not vegan. He's Iranian, and they, I don't think his family didn't really understand the word vegetarianism or veganism. So I did have that to navigate, and my daughter at the time was about 5, so she'd not been brought up as being vegan. So there was that challenge and that transition, but slowly, and my son is now 7 and we're an entirely vegan family. So we hear that all the time, that I want to be vegan but my family is not. How am I going to navigate that? So there are ways of doing it, and we have to be compassionate and we have to be kind, and it may not happen overnight. So that was a journey for me, and I think looking back, it was a difficult one for me for a while, but now I'm at this end. I feel extremely happy and lucky to have a very supportive family. For me, my discussions with my colleagues, they're always difficult, or they have been in certain circumstances. I have been described as the angry vegan when I think I'm just discussing things on a general level. So you do come across that a lot, as we all have. I'm not unique in that. But overall, it's been very interesting. But I would say that the most important thing I have found in coping with those challenges are educating myself. That really is the single most important thing to do, and educating ourselves on the moral questions, how you answer people, and educating yourself on the health questions. That really is so key to it all.
Absolutely. And thank you for bringing that up, because all of us have our own journey, and the transition can be so different and in some ways challenging, at an individual level, at the family level. Things are made more complex when you have children, who weren't initially raised with the plant-based message. And then when you're trying to navigate it with the extended family, things are different and can be difficult. And you're right about educating ourselves not only around nutrition science, but also around the morality of why we've chosen this path is really important. And I know a lot of our viewers are veg curious. They might not be already vegan. They might identify themselves as flexitarians, or might be people who are, hey, I just want to eat healthy. I don't know whether, what I've been taught about dairy being a complete nutritious food is right anymore, because I don't feel right when I consume it. And that's exactly where this wider movement of lifestyle medicine, which I know both of you are a part of, in the world, in your respective countries, that it becomes really important, because as doctors, when the message comes from you, it holds a very different type of importance, for persons, and there's authority in that message. So how does your work in plant-based nutrition really fit in with your current practice as a hematologist, Shireen, and as a radiologist, Zahra? Shireen, why don't you go first and tell us about how do you bring the two together? Is it even possible?
Yes, thanks for asking. And yeah, it's so possible, because the problems I face for my patients are that not only are you trying to treat lymphoma, so cancer of the lymphatic system, not necessarily lifestyle related, not necessarily preventable, but what each and every one of my patients has is some other chronic underlying condition, the commonest ones that are prevalent in our society today: high blood pressure, high cholesterol, pre-diabetes or diabetes, or known cardiovascular disease, carrying unhealthy amounts of body weight, fatty liver disease. So these illnesses are present in my patients, and that makes my life a little more tricky than it needs to be, because people tolerate treatment less well, have greater side effects, and the longer term outcome is negatively impacted by having these chronic health conditions. So it really is a teachable moment when I meet my patients. It's difficult, it's a challenge, and you have to meet people where they are. People have to be ready to take on this information. So I can't suggest that I'm successful in every case, but there is the opportunity to plant a seed for healthy plant-based diets and lifestyles. And we're very lucky in the cancer space. As you know, the World Cancer Research Fund guidelines clearly state that a healthy diet for cancer prevention and for surviving well after cancer involves eating a diet that is centered around fruits, vegetables, whole grains, and legumes. And so I'm able to give that information, and then hopefully some, helpful tips for the individual patient that's relevant for them in their social and cultural context, and taking on board their financial constraints too.
Absolutely. And have you encountered any situation, where you're consulting with a patient, and the patient's like, you know what, doc, just give me the pill. Just tell me what surgical intervention I need. I couldn't be bothered with lifestyle change. How do you deal with those situations?
Yeah, I mean, I think people are very receptive to this information. It's not that they can't be bothered or don't want to give it a try, but there are real challenges. The area that I work in, London, is a real mix of those that have and those that have not. There's a migrant community, people who are worrying about housing, that will lose their job because they can no longer turn up to work because they're having chemotherapy at the hospital. So, those are the challenges. I mean, there's never any resistance to understanding that eating more fruits and vegetables are healthy. People know this intuitively, so it's not a surprise for them to hear. Obviously, talking about things like eggs and dairy and, making more healthful swaps is a bit more challenging. But I think it's the sort of systemic sort of social and cultural contexts that make things challenging.
Right. Okay. Thank you for that. Zahra, how about yourself? Radiation oncology. People come to you when they're desperate, I guess, almost, and there's cancer, and we know cancers can be sometimes very aggressive, and surgical interventions are important, radiology, and all of those things. How do you talk to them about lifestyle changes?
I talk to all of my patients, really, or the majority of my patients, about lifestyle measures at the time that I see people as a new patient. So I actually add on an extra 15 minutes to my consult. I usually go over because I talk so much. But it's a really teachable moment, and people are asking for that information. As Shireen says, people are receptive. Of course, there are people who are not going to be receptive, and you hope that you're planting the seed in those circumstances. And, when the time is right for them, they will come back to that. So I talk to my patients because I think, and I tell them, I think lifestyle measures are just as important as the conventional treatments that we're talking to you about. We never do either or. It's never instead of the conventional treatments, but it is equally important because we know that 40% of our cancers are caused by our lifestyle choices. And not only that, but unfortunately, if you've had one cancer, you are at higher risk of developing a new cancer above the general population. So that piece is important. So we know that lifestyle measures can reduce the incidence of cancer. We know that pursuing good lifestyle measures can help you tolerate the side effects of treatment, improve your quality of life, improve your mood and anxiety symptoms and depressive symptoms. And we know that in survivorship, that undertaking those healthy lifestyle measures can reduce your risk of cancer recurrence, can help improve your outcomes. We also know that advice that we give is the same for reducing the risk of any chronic disease.
Yeah.
And unfortunately, we know that having a chronic disease increases your risk of getting cancer. Having chronic disease increases your risk of dying of cancer.
Yeah.
And our treatments also induce these problems as well. Our chemotherapies and radiation can increase your risk of heart disease. But the advice is exactly the same. I mean, that's the beauty of it, that, eat a healthy plant-based diet. And as Shireen says, our international cancer guidelines state that. Have a diet that is rich in fruits, vegetables, whole grains, legumes, nuts and seeds, and maintain a healthy body weight. Do some physical exercise. Avoid risky substances. Don't smoke. We have big anti-smoking programs within the cancer center. We tell our patients alcohol is a class 1 cancer-causing agent. That message is not getting out there, but and my patients who have breast cancer are always surprised when I tell them that about 8% of all breast cancers are caused by alcohol use, and people don't know that. So it's a great moment to teach them. And we talk about how good sleep and stress management is so important during this time. So I do take that time, and it is only 20 minutes. I don't have resources. Shireen doesn't have resources to then help people on that journey any more than that. I have Michelle, the co-founder of PlantBased Canada, who's a plant-based dietitian who I refer my patients to if they want further information, and we have written resources to point them to. So most people are really receptive. Most people are asking for that advice. And I also find that people are so grateful for it, and you can see their anxiety levels come down.
Okay.
So even when I'm speaking to someone and I can feel that barrier when I'm talking about all the standard treatments, and I'm thinking, do I take extra time to speak to this patient about this, or do I let them go because they're just clearly not wanting to be here?
Right.
But when I do, I see that anxiety level come down. It speaks to a different part of people, and I hope they feel some hope because it gives them some power back as well.
Exactly, because when you're, it's just bad enough when you have that diagnosis, and people have to process that, and then when you start talking about surgical interventions and all these pharmaceutical things, and when to take this pill or that pill, what might be the side effects of some of the things that people are asked to take, it can be quite a lot to navigate, and people kind of shut down at that point in time. But when you guys, both of you, keep aside time to talk about plant-based nutrition, as you mentioned, Zahra, it does feel very empowering. It feels like, okay, I can go back and I can do something starting right now, which is not going to harm me. I mean, and let me give it a shot. So I'm glad that your patients are receptive. How has the pandemic impacted the receptivity to this message amongst your patients? Shireen.
So, yeah, I mean, obviously life has become so much more difficult in the pandemic. Those that were already struggling to afford healthy foods, things have been made even more difficult. People are trying to juggle keeping their jobs, navigate treatment. But I don't think, people are less receptive to hearing this information. I guess implementing it and getting that social support we all need to make these healthy habits durable has been a bit more difficult to get going. We ask our patients to come with only one relative or friend, and visiting to the hospital is very much limited. So those sort of things where you have that social support, I think people are missing out on. And people's moods, obviously mental health has deteriorated for a lot of people, and I'm sure the cancer community has suffered even more than those without cancer. So I think those are all sort of potential sort of negative predictors of being able to take on new healthy habits and behaviors and maintain them. But having said that, there has been some great sort of media coverage on how healthy habits and diets are important. I mean, albeit not enough into action. But the UK government has recognised the issue around food security, healthy food choices, and trying to support citizens in general to make these healthy choices.
Yeah, and that's incredibly important, for governments to increasingly realize that there's a lot that they can do, to make life easier. But there's one thing that you guys have done. You've actually written an awesome book, and I can't wait to actually bring it up on the screen for our viewers to see. Here is the book. It's Eating Plant-Based: Scientific Answers to Your Nutrition Questions. Right. What motivated you to write this book?
Well, I'll go first then. Well, I guess for me, it comes from, over 9 years now of having to answer these questions for myself, for my patients, for colleagues, as founder of Plant-Based Health Professionals, as course facilitator at Winchester University. The same questions keep coming up again and again, and I thought it would be great to have a resource that really sort of does a deep dive into the common questions, provides the scientific evidence, to provide also reassurance to everyone who's looking to shift towards a plant-based diet, or for already vegans and already those on a plant-based diet, to reassure them and empower them in their own education and advocacy to spread the message. As you know, I write a weekly blog, and I've been doing that for over 2 years, delving into the science that keeps coming out, new papers every week. I review 4 or 5 papers every week, and the science hasn't changed. It hasn't changed for decades, and it won't do. All the evidence is pointing to focusing on healthy plant foods as the basis of any healthy diet pattern. And for myself and Zahra, 100% plant-based is the only option when you take into account the planet and the animals. And we wanted to bring that level of reassurance to readers and those curious that you really can thrive, not just survive, but thrive on a plant-based diet.
That's such an important message, that you can't just survive. And this is not even about being deprived, because, initially when you start talking to people about, hey, I eat plants. What? Do you not eat this, that, and that? And like not even oil? Like I'm a whole food plant-based oil-free vegan, if you like. And then people are like completely flummoxed. They're like, I don't know how you eat on a daily basis. So you're absolutely right. This is not just about survival; it's about thrival, and we are thriving, individuals because of this. Zahra, what was your reason? And who came up with this idea? Did Shireen just call you up and say, hey, I've got all this amazing ideas. I got to put it together in a book. Let's do this. How did it happen?
Divi, that's exactly how it happened. So as Shireen said, for 2 years she's been doing this, this weekly look at the plant-based nutrition news. I don't think there are many people who know the plant-based literature as well as Shireen does. So when she this was totally her idea. And when she asked me if I wanted to join her in the journey, I was very honored and happy to come and support her as much as I could. And the reason we chose the question and answer way was because that was the learning tool that speaks most to us. And we had been totally changed in our viewpoints by Gary Francione's book, Eat Like You Care, which was in the question and answer format. So that really spoke to us. And as Shireen said, it was our lived experience. So it was really easy to come up with the questions as it is for most vegans, because we get it all the time.
Right. And why is it important for us to get scientific answers? Because a lot of the times people are like, science, if science had to change things, we would all be walking around with washboard abs and, bikini bods or something. But people read books and, they don't, because they're so emotional about when they eat. So we need emotional answers to nutrition questions. But why scientific answers?
Well, I think as health professionals and scientists, I've done a PhD. I mean, we value that rigor that goes into creating the scientific knowledge. And, the scientific method is well researched. And you just need to know how to pick out the key points and, understand the flaws or the greatness of particular papers and bring together different elements of the literature, different types of studies to create that certain knowledge. And most of what we've written about is certain. We write about the dilemmas about oil and no oil, but those are just little small bits around the edges that doesn't take away from the main message. And I think, if you're not sort of used to understanding scientific literature or knowing how science works, you can really pull out any paper from the internet and find an answer to a question in the way that, reinforces your own beliefs or choices. But I think what we've done is bring together different types of studies, observational, randomized, mechanistic, that really tell the story of how we just do not need to eat animals or any aspect of animals, whether it be their milk and their flesh, honey, etc., to thrive. We're omnivores, we're opportunistic omnivores, as people say. We have a choice, and now many of us, certainly the three of us, in a privileged position where we can make that choice that is kinder and more compassionate without compromising anything, but perhaps even improving our overall health.
And who's this book for? Because a lot of the times when people think about science and they think about people with advanced degrees and doctors like yourselves, can a regular person, can our viewers, moms, soccer moms, can they just pick it up and learn something from there? Are there any recipes or how have you packaged all this information that can be pretty daunting for a lot of people?
So it's for anybody who has an interest. So it's for the public, it's for health professionals who are meeting people every day in their practice now who are asking questions about the plant-based lifestyle. It doesn't have any recipes, but we're hoping that the question and answer format is a more simple way to get the knowledge. And it has 14 chapters. There's a general chapter at the beginning, and then there's a chapter on meat, and then one on fish and eggs and dairy, and then nutrients of concern and specific questions that come up all the time. So we hope we've made it accessible in that sense.
And where can people get it from?
So it's available on pre-order from bookdepository.com. Okay. Which is probably the cheapest one. I think Foyles has it for a similar price in the UK. It's also on for pre-order on Amazon, but at a higher price. And the Book Depository has worldwide free delivery.
Okay, so it's Book Depository, and it's also on Amazon.
And Foyles and Waterstones in the UK also have it on their websites.
Okay, this is awesome. And by when can people hope to receive it?
January 20th is the release date.
Okay. That is perfect. I have just added that to our banner so our viewers can have a look at this. This is your new book that's just out, Eating Plant-Based: Scientific Answers to Your Nutrition Questions. As Zahra and Shireen explained, there are different topics. It's in a Q&A format. You do not have to be a licensed healthcare professional to be able to understand this book. So I highly recommend, please get your copy today, and you can pre-order it on bookdepository.com or on amazon.com. And there are a couple of other extra places where, you know, it's also available in the UK. So tell me, what can the readers, you know, expect? Well, you've mentioned about the chapters and about different ingredients and different food groups and so on. Can the readers expect to understand and receive this information in a way that if they're vegan already and they want to go and talk about it to others, can this be used for effective advocacy? I guess that's what the question is.
Absolutely. That was the whole point. This was the book that we wanted to read. When we started our journey, we would have loved to have this. You know, I know Layla always says that about her book that she edited with my father. That was the book that she wanted to read. And that's exactly the thing that we say about this book as well, because it has all the information you need to advocate to others, to have confidence for yourself that you're doing the right thing as well, that you have confidence that you're doing the right thing for your family as well, for your children as well.
And since you bring up Layla, who's a dear friend, you know, I have to bring up this family picture. I mean, you guys are a fabulous family. And we've had Layla before on the show. This is the book, you know, that you just referred to, Zahra, Rethinking Food and Agriculture. And I think that between these two books, you've got the complete guide for effective advocacy. You know, you can talk about food and agriculture. You can talk about nutrition science and get scientific answers to how you're eating. And of course, the work that you're doing, both of you in your respective, you know, countries with respect to plant-based eating. So, Zahra, my next question is for you. Would you say that the Canadian Dietary Guidelines are supportive of a plant-based diet?
Absolutely. We have one of the best dietary guidelines in the world, country-specific guidelines in the world. It was updated in 2019. It's very evidence-based. They didn't allow the usual lobbyists to come in and influence the guidelines. So this was something quite unusual, and it allowed for this very evidence-based guideline. So if you look at the plate, it is mostly plants. Half the plate is fruits and vegetables, a quarter is whole grains, and a quarter is protein, of which they say very specifically, you know, emphasize plant proteins over animal protein. So it's at least 87.5% plants. It has taken dairy out as an essential food group. So that's huge. There was a lot of, you know, the meat and dairy industry, which have a lot of power here in Canada. There was quite the backlash. There was a lot of articles in the newspapers, and it's great. It's a fabulous guideline. The difficulty is it's not really translated into everyday practice still, but it was a huge step forward, definitely.
Yes, I do remember when the Nutrition Canada came out with, we're not going to include dairy anymore. And out here in the United States, we were like, wow, this is awesome. Like, USDA, wake up. We really, really need you guys to pay attention. This is what your neighbor's doing. So Shireen, what do you feel about the UK's population dietary guidelines? How do you think they compare to, how Zahra just described the Canadian guidelines to be?
Yeah, so we have the Eat Well Guide that came out in 2016, and actually it's not so bad. When you flick up the poster again, you'll see that 2/3 of that plate, the green and the yellow, are all plant-based foods. They're fruits and vegetables and whole grains and starchy vegetables. There's that blue section there that is for dairy, but clearly states dairy alternatives without sort of suggesting one or the other. And that pink bit is protein, and it clearly says in the small print that we can't read right now, says choose plant proteins and beans as your preference. So it's really not so bad, but we have a problem worldwide, I think, that dietary guidelines are just not implemented. It's that implementation step, so there's quite clear studies showing that if the nation ate as per the Eat Well guide, our health would be so much better and our environmental footprint would be better. So it's not bad. And it's very adaptable to a plant-based diet, and that's what we did as part of our work at Plant-Based Health Professionals, was just sort of veganize it, and it was totally straightforward. It wasn't that difficult. We just had to add the B12 and considerations for iodine, because of course dairy is the main source of iodine in the UK. We don't iodize our salt. So it is hugely adaptable for a vegetarian and also a vegan diet. So I don't have great problems with it. Of course, the next guide I would hope would not feature at all any dairy, would make a point of noting the unsustainability of fish consumption, and really it tells citizens not to focus on animal sources of protein at all. It really is not necessary. But if we got a step closer to that, I think we would all be doing so much better.
Right, absolutely. We're inching towards a plant-based future, and that's how it's going to be. And I know that you guys have actually put together something called the Eat Well Guide. I'm just going to bring it up, and I'd love for you to talk to me a little bit about this.
Yeah, so as I say, it's just a plant-based version of our UK Eat Well Guide. We just called it the Plant-Based Eat Well Guide. And as I say, it's really, really adaptable. That blue section now that did include some dairy in the original version is just now dairy alternatives, such as soya or pea or oats, or whatever your choice is for your plant-based beverage that replaces dairy. And then, in the protein section, we emphasize healthy sources of protein, which is beans, nuts, seeds. And as I say, emphasize getting plant sources of omega-3 fatty acids that most people are used to getting from fish, but we know are easily obtained from seeds such as flax seeds and linseeds, the same thing, flax seeds, hemp seeds, chia seeds, and also walnuts, and even soya is a good source of omega-3 fatty acids. Taking consideration about how you're going to get your B12 and your iodine, and obviously vitamin D for the whole nation, probably all year round, looking at our sun exposure.
Right, absolutely. And you both mentioned about how, even though these national dietary guidelines are more or less there, I mean, they're starting to call out things, even though in fine print, choose plant-based alternatives. And obviously, Canada is leading the way, actively choosing to remove dairy from their guidelines. But you mentioned the implementation part and things that are missing. So what do you think are the barriers against adoption of either an entirely plant-based diet or a plant-forward diet, and really implementing what the government says that we should be eating?
Well, I'll have a go at this for the UK first. I mean, I think, the governments say one thing, but then actually do not implement it themselves. So it's literally all the way from farm to fork we have the problem. If you think that of the fact that over 70% of farmland in the UK is dedicated to producing food from animals, be it meat, dairy, these are foods in inverted commas that are not required, are harming us health-wise and planetary health, yet we are producing too much meat that we can export, and we are only producing enough fruits and vegetables for about 20 to 30%, compared to wanting to produce 100% and be self-sufficient, which we used to be not so long ago. So we really need to flip our farming system if we really are going to put into practice what we should be preaching. I mean, we can't be producing food on the one hand that is not necessary, that's harming us, and yet be telling people to eat things and eat products that we have no capacity to actually provide. So, I mean, that's first and foremost for me in terms of how the UK needs to move to a plant-forward food system. I'm not saying I've got the solutions or answers to this, but until we recognize that it's completely upside down with production. And then it comes down to, you know, what we're serving in public institutions at these teachable moments in schools and hospitals and universities. You know, that my hospital is still serving processed red meat, and it's going to be a challenge to try and remove it. I mean, they've committed to it, but then actually getting rid of it is a different matter. And then the education system itself, you know, as we've said, health professionals are not necessarily brought up to speed in this latest science, which is the aspect that we're trying to address through our education programs. So, you know, just about 2-3 weeks ago, the UK have now got a set of core curriculum and competencies for medical students that will have to learn nutrition as part of their course. But when you actually do a deep dive into that document, the only time that the words vegan and vegetarian are used when they talk about restrictive diets and nutritional concerns. And there was not a word about sustainability. So that made me sad, because it just leaves it open, doesn't it, for everyone to teach diet as they are used to doing, and it doesn't help us move forward. But I'm encouraged because just today, actually, plant-based health professionals gave a teaching session to 80 medical students at Exeter University as part of their global and planetary health module. So I think, you know, opposed to the nutrition and dietetics learning, I think, you know, global health, planetary health has now become part of the core curriculum, and that group of individuals are much more open to talking about plant-based diets as sustainable diets. I've kind of gone slightly off track here, but you know, we've been instructed by organizations like the International Association for GPs and also the Eat Lancet Commission that healthcare professionals are key to implementing these sustainable diets. So, you know, coming back to the barriers, it's kind of educating ourselves as health professionals and then being confident to support individual patients, communities and policymakers to do the right thing. So all the way from farming down to individual choice, with education in the middle, needs to change.
Right, and you mentioned farm to fork, right? So it's one thing if the food policy is a certain way, or government guidelines are a certain way, but if the farm to the fork, the supply and the demand variables are not looked into, and education across all points, on the spectrum, looking at educations for nutrition professionals and medical health professionals, and also students, in medical schools. And congratulations, you spoke about the Exeter, University and the students over there, and you found that when we talk about planetary health and global sustainability, that group and those groups tend to be a little bit more open towards plant-based diets. And I sometimes even think that the word diet might not be right, because it's a lifestyle choice. This is a lifestyle that can check so many different boxes beyond just one's own health. Zahra, the same question to you. And you did mention about the farmers' protests, and when the Canadian guidelines chose to obviate or omit dairy. What were the barriers? What was the type of backlash that you saw that happened, and what are some of the continued barriers for implementation?
So it's really, as Shireen says, it's all society. From the government level, they're still subsidizing the meat and dairy industries to millions and millions a year. And the education piece, our health professionals are not educated. So all of the things that Shireen has said. Specifically in Canada, I can give you a couple of examples. I mean, certainly all the adverts on TV from the dairy industry are all about, it's this greenwashing of animal agriculture going on at the moment. And one other example we had was just at the end of last year, we found out that TVO, which is the TVOntario, it's a publicly funded organization in Ontario, had joined forces with the dairy farmers of Ontario. So they're getting into education and getting into the classrooms, and so TVO was now promoting the dairy farmers of Ontario education. so, we looked at it, and of course they've got the Canada Food Guide. They've taken out the water, which has replaced milk on the picture, and they're talking about dairy, and we were so horrified at this. So they're just kind of, as they've done for many years, getting into the classrooms. They're now doing it online in the time of COVID and all these adverts, etc. So we did actually, we wrote to the TVA. I got a lot of health professional signatures on there. We got ourselves on CTV News, national news channel, through one of my Plant-Based Canada team members, actually, who's a CTV News producer. And eventually, the partnership has ended. We can't get an answer as to why that ended, but we're hoping that some of our advocacy has something to do with it. But these are the things that we have to battle against, because it's at all levels, and the level of misinformation that is out there. Our newspapers, putting out the stupid stories, just like they do all over the world, about children's health and not getting enough this for brain health and blah blah. So combating that with education is so key. But and as Shireen is doing as well, trying to influence policymakers, we're trying to do that at all levels. In Canada now, there is some cause for excitement, I think. We have a small but passionate and growing group of lifestyle medicine practitioners. I've been lucky enough to be on the working group of the lifestyle medicine practitioners who have just a couple of months ago formalized themselves into the Canadian Lifestyle Medicine Advocacy Group, a member interest group of the American College of Lifestyle Medicine, which is, of course, the flagship organization for lifestyle medicine globally. And we've started to talk about, or that group has started to talk about, lifestyle medicine interest groups in the medical schools and in the residency programs. So we're trying to get into the education system through that. And there's a lot of plant-based health professionals now growing. That we have an amazing lifestyle medicine practice in BC called the Aroga Group, which is just for lifestyle medicine. They're expanding across the country. We have individuals having lifestyle medicine practices. There's a long way to go, but we're starting to see some really great changes, and gives us cause for hope. Guelph University are in the process of developing their first plant-based nutrition course. That's the only plant-based nutrition course I know of in Canada. So we're seeing changes gradually.
Right. And Zahra, there's an added complexity, of course, with the culinary tradition in Canada, with, French Canada and Quebec, being very dairy orientated. I'm reminded of a book that a Harvard sociologist, I think she's still writing it and it's about to come out, and they're talking about a comparative narrative about cultures that are resistant to plant-based change. And they mentioned Israel, the United States, and France being the most resistant, and Israel being least resistant, and then the US being somewhere in the middle. And could you comment a little bit around the lifestyle medicine movement, or the plant-based movement, or vegan movement, as it may be, in the French part of your country versus the Anglophonic Canada, and if you've observed any differences in barriers against adoption, or none at all? I might be totally inaccurate about this.
Yeah, I can count on one hand the lifestyle medicine practitioners from Quebec who are promoting plant-based nutrition, but I don't know if that's because I'm only getting a small view of it. But yeah, recently PCRM had reached out because they wanted French-speaking people for their educational activities, and we were able to find them a couple of French-speaking Canadians for that. So, but yeah, small numbers.
Yeah, so those challenges continue on, but because of the amazing work that, Zahra, you're doing in Canada, and with Shireen, what you're doing in the UK, there is hope. And thank you so much for writing this awesome book. The book is out, everybody. I highly recommend getting a hold of Dr. Shireen Kassam and Zahra Kassam's book. It's called eating plant-based, scientific answers to your nutrition questions. Thank you so much, Shireen and Zahra. I have another person who's actually just joining us for the last 4 minutes of our conversation. I'm adding her to the stream. I think Katie's right here with us. Katie, hello, where are you joining us from?
Hi, thank you so much for having me, Nivi. And it's very nice to meet you all. I'm here in Tacoma, Washington.
Yes, thank you so much. So just to introduce to you both, Shireen and Zahra, and our viewers, Katrina Monti, she is retired from the U.S. Army. She's a clinical research facilitator, and she's a consultant volunteer with a project called Project Gaia. Tell us a little bit about that, Katie.
Yeah, so thank you so much for giving me time to talk about this. So Project Gaia is a JIVINITI public health research study that is, we are evaluating the connection or relationship between nutrition and COVID-19 incidence and illness severity. And we're really trying to focus some of our respondents to our survey. So this is an online survey. It's only about 8 to 10 minutes or so. But we're really trying to get people who are among our Black, Brown, and Indigenous communities to take our survey so we can hear their voices as well. Because as of now, some of the research studies that have come out, the more prominent ones, haven't really had a large sample of these populations, and we really want to hear their voices. Our study is online. It's only about 8 to 10 minutes or so. It's open to U.S. residents only at this time, U.S. residents and U.S. territories as well. And it's currently funded by the T. Colin Campbell Center for Nutrition Studies and Veg Fund, A Well-Fed World, and the VIRSA Foundation as well. We really want, especially, as I said, people that are among Black, Brown, Indigenous populations to come forward and take this survey. And because we'll be able to discover, what is the link between the dietary patterns in different communities and COVID-19 illness.
Right. Thank you so much for that, Katie. This is a very important, clearly, it's a very important, research project. I know there are some studies that have come out recently as well, talking about the correlation between, dietary patterns and COVID-19 symptomatic severity. We wish you all the best for this project. Thank you so much for joining us. And Shireen and Zahra, thank you so much again. It has been a pleasure. Is there any last remarks about the fantastic book or the discussion that we've just had, Shireen and Zahra?
Oh, well, thank you, Nivi. Great to be able to talk about something. It's a real excitement for us, and I really hope that it will support people's education and advocacy. And we even cover COVID-19, so you might find some more information in there.
I just want to say thank you, Nivi. Thank you, everyone. This has been wonderful to hang out, and thank you for all the work that you guys are doing as well.
Thank you so much for all of your work. And until next time, thank you so much, viewers, for watching JIVINITI Connecting the Dots. I'll see you next month.